form with your email address and say you're interested in the liposuction special. I will tell you that to take advantage of the liposuction special, you have to pay for it by the time it ends, which is Wednesday. It'll be Wednesday at 5 o'clock. So, and this is the last time I'm extending it. I'm not going to do it again. So, if you don't get an email tomorrow by noon, then call my office at 678-325-0006 and ask to be added to the email list. Just like I've submitted my email, but I never got the message, and asked them to send you the message. In the hospital, the fee that I told for a tummy tuck, the fees that I quote people is OR, anesthesia, and surgeon's fee. If you're getting liposuction in my office, there is no anesthesia fee because you're awake. I do local anesthetic, and you don't go to sleep. So, that reduces costs also, but it also makes the recovery easier because you're not metabolizing anesthesia. But I do a lot of awake liposuction, and everybody is surprised at how comfortable it is. So what will end up happening is people will be nervous, and I'm like, no, it's fine. And I explain to them how the process goes, and then they're nervous up until I get going, and then they're like, oh my God, that's it. And then they'll start ordering other areas for liposuction when they see how easy it is. It's really not bad at all. Once you're numb, you don't feel anything. It's numb. So the way I do it, when you first get there, you take some medicine just to make you relax. It doesn't make you sleepy. Well, some people get sleepy, but it's not like, it's like sleepy like I was at the beginning of this live when I was yawning, but I'm awake and talking. It's that kind of sleepy. It's really just to make you not be as nervous and worried about every move that I make. And then I mark you, and then I start the process of numbing you, whichever area I'm going to work on first. When I do 360, I tend to do the back first, and then so we'll have you lay on your tummy. I'll do your back, numb it. It's not like Twilight. Twilight, you're kind of out of it, and you don't. This, you're awake. I literally have conversations with people while I'm working. Like, we'll talk about all kind of stuff. We'll be watching TV or listening to the radio, talking about celebrity gossip, like literally awake. Sometimes we're talking about business stuff. Sometimes we're talking about marriage and relationships. Like, it's literally like lipotherapy or lipo coaching. Like, literally folks are awake. So it's not Twilight. Twilight, you're like out of it, and you don't even really know what's going on. We are awake and having conversations. It's awake. But once you're numb, sometimes people don't like it when they turn over and I start to work on the front, because when I'm working on their back, they're laying on their stomach and they can't see me. But then sometimes when they see like the lipo cannula and stuff, some people freak out. And so if they don't want to see what's going on, then we have some people will put on eye masks and lay there, and we'll talk with them blindfolded because they just don't want to see me working. But most people are okay. For lipo 360, I usually have 5 little stab incisions in the front, but they're super little. Like, they're really little. And in the back, it could be anywhere from 4 to 6 for me to get everywhere I need to get to, especially if it's some contouring with it. Okay, let's see what other questions I may have missed. Is there a way to fix flat spots, round out gluteal fold? The gluteal fold, it depends. It really depends on what it looks like, what you're talking about. The gluteal fold is one of those areas that we're supposed to respect and try not to violate it, because it's hard to recreate it when it's damaged. That's one of those. There's certain things that God made that we need to leave alone as best we can. And the gluteal fold is one of them. Depending on what you have going on, I mean, we have tricks to try to make things look better, but it almost never looks as good as the one God made with the gluteal fold. You can start exercising 3 weeks after. Yeah, Corey, it's some people that are like, they're so freaked out, and then once I start and they're like, that's it, and they're like, and then they relax for the rest of it. It's not bad at all. There's like maybe 2 people I can think of, and I've done this. I've been doing it this way for a year and a half now, and there's only 2 people that I can think of that I said, if we ever do lipo on you again, you're going to sleep. And everybody else is fine. Danielle Paul, it depends on where you live. So if you live in Atlanta, if you got it done on, say, a Friday, you really just have to take Friday off work if you work Monday through Friday. It's a 48-hour recovery for lipo alone. If you don't live here, then you need to be in town for 5 days. I don't want you, unless you live like 2 hours away or something, somewhere super close. But if you're like taking a flight or riding 5-6 hours, you need to be here, prepared to be here for 5 days, except you won't be like feeling like you're recovering for 5 days. So really it's the 48 hours and the other 3 days you can see Atlanta. But I don't want you in a car for a long period of time or on an airplane, the day after you got liposuction, because it increases your risk for blood clots and stuff like that. Yeah, so if you live in Texas, then you need to plan to be here for 5 days after your surgery. Okay, let's see. All right, is that all y'all got for questions? Okay, so if you want to take advantage of my liposuction special, which I extended because of all the people who missed it, and some of that may have been my fault, because it sounds like some people gave us their email address and somehow didn't make it onto the list when we sent out the email. So if you never got an email, you need to go to this website right now, or you can contact me on this page. Send me a private message on this Dr. Myla Bennett page with your email address and your phone number, and we will send it out to you tomorrow. And I will have the special also include gluteal contouring, since I talked about that tonight. If you had lipo 4 years ago, can you get the same area done again? Yes, you can, Ruby. You can get it done again. Tommy, I don't think it's a good idea to be awake for a BBL. I would not have somebody awake for a BBL. I think you need to be in a hospital setting and asleep, especially if you're getting some of the fat transferred into the muscle. Like, that just doesn't sound like a good idea. And it should definitely not, it needs to be in a super sterile environment when you're putting stuff back inside. Yeah, but that's, I'm not sure what they're doing there. I'm not really trying to come on here to bash other people's situations. I don't know who that is, but I wouldn't do that. But also there's plenty of plastic surgeons who say, I wouldn't do the amount of liposuction that I do awake, they wouldn't do it awake. So just because I wouldn't do it doesn't necessarily make it wrong. So, it's just the surgeon's comfort with certain things. Like, I mean, when I trained, there was one surgeon that I trained with who's a very good surgeon, and he didn't have people put all the way out for breast dogs. And I was like, there's no way I would do that. I'm not. But he did it, and his breast dogs were beautiful, and he was ethical, and he was safe, So it just really depends. So I don't really like to throw out blanket statements like that. If it's a real plastic surgeon, that's the most important thing. I think that's the most important thing you should be looking for. And at that point, it's just the comfort of the surgeon with certain things. We're not going to all like doing the same stuff, and we won't all do it the same way, which is one of the beautiful things about our specialty. And 2 years ago, I wouldn't have even done liposuction with people awake to the extent that I do it. No one that trained me did that. I got pushed out of my comfort zone when I first moved to Georgia, and I was just trying to find work to make ends meet while I was getting my practice built out and stuff. And I was working at this place where the only option for me to do it was awake. And I hated it at first, and I wasn't very good at getting people numb enough. And so it was a lot of ooey owie and stuff like that as I was first getting comfortable doing that amount of local anesthetic. And it took a couple months, and I got really, really good at it. And now it's like I don't even have to think about it. It's second nature. I can get you numb. I can make it comfortable, and we will sit there and talk about the Kardashians or the Real Housewives, or be watching HGTV, House Hunters, and trying to decide which house they're going to pick. Like, literally, like, it's that relaxed. Or we'll be sitting up listening to 112 radio on Pandora, and I'll be singing, and I cannot sing, and they'll be laughing. But I like to sing, but I'm not very good at it, But before, when I first started doing it, and I was pushed, kind of out of my comfort zone, I wasn't singing those songs or talking about nothing. I was focusing on trying to get the person numbed enough. But now I do that with my eyes closed. Well, not literally. I do surgery with my eyes open, but you know what I mean. Figure speech. So I don't like to go and make statements like, oh, that's bad or good, when it's not wrong necessarily, but I personally, with fat transfer, would take them to a surgery center. So the mommy makeover, this is really popular season, so that like I can squeeze a liposuction into my schedule since the only schedule I'm dealing with is mine, and it's my office, and I can work as late as I want to. So a liposuction I could get in much faster than like a mommy makeover, because we're also relying on the availability of the hospital OR. And this is a very popular season for surgery. So if a mommy makeover is something you're interested in, you should probably reach out ASAP for scheduling purposes. No, fibroids has nothing to do with your liposuction revision, because fibroids are behind your muscle and lipo happens on top of your muscle. So it's completely unrelated. So whether you're awake or asleep has nothing to do with it. I wouldn't be anywhere near your fibroids. Your fibroids are in your pelvis, which is and liposuction deals with the fat on top of the muscle. So it's totally unrelated. What is the difference with fillers and doing a full BBL, or is it the same thing? So some people get filler or injected into their butt, like Sculptra is a really popular one in the United States to put into people's butts to make them bigger. That is so expensive. Okay, the amount of Sculptra you would need to make your butt bigger, like noticeably bigger, you're literally looking at like $40,000 or $50,000 worth of Sculptra, and it's only supposed to last for 2 to 3 years. So unless you are like Kardashian rich, that's not really a good option. Now, it's good for filling in like cellulite and stuff like that on the butt, but if you're like trying to make your whole butt bigger, like that is like, I don't even know why people started doing that, because from a cost standpoint, it just doesn't make any sense to me. And so a full BBL, the filler is your own stuff. So it's liposuction, and then the fat is like processed and then re-injected back into you. So you have plenty of it. And so it doesn't, it doesn't cost $40,000 to get a BBL. Oh, fibrosis. Okay, fibrosis. Okay, so fibrosis